Well, I'm Doug Curran. I'm a family doc in Athens, Texas, and I'm testifying on behalf of TMA and several other physician organizations and represent about 53,000 physicians, medical students, and residents. You know, in Texas, we're booming. Lots of good things happening. Economy at about $1.8 trillion. Good things happening on lots of levels, but really struggling with some of our healthcare issues. I've been invited to, or been interviewed a number of times by various organizations about where we are, how we're booming, and how the struggles with healthcare are still there. You know, we would like very much from the TMA to commend Chairman Coleman for his steadfast leadership and commitment to finding a way to increase health insurance coverage for working Texans. The health of our patients in our state depends on us finding a solution to move forward with healthcare issues. You know, as already been pointed out, we currently lead the nation in the uninsured. About 20% of our populace is uninsured, and the vast majority of those are between 19 and 64, and most of them have jobs, maybe even one or two jobs. And, you know, my son and I were recently talking, and he said his health insurance now exceeds his house payment. And a lot of that's because it's all shifted around. And it creates some real challenges for all of our people. We're also seeing an increase in maternal mortality and difficulties with women that circle around pregnancies. And that is directly related to access to care. If you don't have access to care and don't get appropriate prenatal care, outcomes are just not as good. You know, when 1 in 5 children in the United States that's uninsured lives in Texas, that bothers me a lot. And I think it bothers you all too. I know it does. And, you know, our rural hospitals are struggling. I practice in a rural community, and we've had 22 rural hospitals close in the past 5 years. And 13 of them now are in some significant financial issues. And trying to sort out what we're going to do with those is just, it's a major challenge. It's something we're going to have to begin to deal with. You know, I am concerned that Texas' Achilles heel, as we see this booming economy and a lot of good things happening, is going to ultimately be our health care and how we can provide that and how we can maintain a good, healthy workforce. Because if our people aren't healthy, they're not going to be able to work. And what I see right now is people not getting appropriate preventative care because they just can't afford it. And they're not getting evaluations when they need evaluations. They're ignoring symptoms that have to do with chronic illness. I don't want to deal with it, so it doesn't exist. And, you know, we know that if parents are not insured, then kids are probably not going to be insured either. The reality is that. And so we're seeing kids not getting the appropriate care that they need to get. So they're healthy kids. They stay in school. They get well educated and very functional. I want to tell you a quick story about one of my own patients. I don't know about you guys, but I'm a fan of pretty good country cooking. I think it's a Texas thing, you know, and you can tell by looking I enjoy that. But there's a little restaurant up the road up in Eustis, Texas, not too far from where I live, and I have to go up that direction to Gun Barrel City. We have an office up there. By the way, I don't think there's any other state in the United States that could have a Gun Barrel City other than Texas, but we have Gun Barrel City. Oregon has one too. Well, I stand corrected. And but I think it's an interesting place, and the folk up there are great people. I don't take a thing away from them. And we have a vibrant clinic up there with 4 physicians, and I periodically work up there. But I try to schedule my trip up so that I can make a stop at that restaurant. It is top shelf stuff, you know, home cooking, good fresh vegetables and so forth. That young lady who does the cooking and kind of runs the restaurant showed up in our emergency room a number of months ago with massively swollen legs and short of breath and significant difficulty. And she was in early congestive heart failure. And after pulling off about 40 pounds of fluid and stabilizing her over about a 3-day period, you know, I could send her out on basically 3 medications that are $4 medications. But the dilemma is she has no resources, no health insurance, can't even begin to afford health insurance out of her little business. And when she's not there, that little business doesn't happen. And the people who work for her don't work. And then her kids are struggling. I mean, it's back to how do you eat? So I think that these are the sort of issues we're dealing with. And my patient, there's 4.5 million of Texans out there who are like that, who are uninsured. And her story is no different than a whole lot of other stories that are out there. I think our economy is inexplicably tied to health care. And we've got to deal with that. If we have a tip at all in our economy, then we're going to see major problems with health care. And trust me, the canary in the coal mine is our rural hospitals. Bigger hospitals are going to start having the same problem because you can't have 30% of the people showing up. And our growth rate at 500,000 a year, the biggest majority of those are people who are going to take jobs that are more moderate jobs that aren't going to have health insurance. We're going to see those numbers continue to grow. The strain on the system is going to continue. The opportunities that House Bill 565 presents, we need to take advantage of those. We need to step up and move in a direction where we protect our people as best we can. I think the Medical Association has stood firm that we need to draw down every federal dollar we can to move in a direction where we can take better care of our people. We don't want to leave money on the table that we ought to be taking advantage of. We need to figure out how do we want to do that. We need to do that in a Texas way that fits our system and our people. But we need to draw down every federal dollar we can. We ought to be about figuring out how to do that. Other conservative states have taken advantage of it. Indiana has taken advantage of it. Arkansas has taken advantage. A number of others. We can figure out a way to do this. We're Texans. We solve problems. We need to solve this problem. Thank you for the opportunity to speak with you. Be glad to answer any questions.
Thank you, Doctor. Any questions, members? Really appreciate you joining us today.
Thanks. Yeah, I appreciate it. And extend our well wishes to the chairman, if you would, please, Chairman Coleman.
You got it. Wait 1 second. I do think we have
Dr. Curran, I don't really have a question. I just have a comment, observation. So I may not know a lot about Gun Barrel City, but you're looking at a doc from Cut and Shoot. So we have other cool names in Texas.
That horse will ride. I'm from Athens, Texas. So,
but I just want to say, from one doctor to another, and as a legislator, I really appreciate the fact that we have a primary care doctor engaged in the rural practice of health care at the leadership of the Texas Medical Association, and I thank you for coming today to testify.
Thank you, sir. Well, it's very humbling to get to do this, and I'm grateful that I can speak up for my patients. I have loved this profession, and I have loved my patients. Most of them are my friends, and life doesn't get much better than what we get to do, and you know that. Thank you, sir.